Welcome to today's HealthLine webinar from the American Association of Kidney Patients titled Key Considerations Support for Care Partners if a Loved One Transitions from Home to a Skilled Nursing Facility. Thank you for joining us today. My name is Jerome Bailey. I'm the Director of Patient Engagement and Advocacy for AAKP. As the oldest and largest fully independent patient-led kidney patient organization in the U.S., AAKP is proud to host webinars as part of our mission to empower fellow kidney patients, family members, care partners, healthcare professionals, researchers, and policymakers. AAKP's HealthLine and HealthLine Innovator webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment, and to that end, AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient care choice and access to all available treatment options. At AAKP, we also work to ensure that patients have a central role in the research and development process so that unmet needs are identified and unique patient insights and lived experiences fully inform innovation and the product development lifecycle. This includes clinical trials to regulatory action and payment decisions. Through our initiatives, we aim to leverage the lived experiences and unique insights from the kidney community to help drive meaningful advancements in kidney care. As medical science progresses with personalized medicine and cutting-edge technologies and novel treatments, the potential to disrupt the status quo for better outcomes in kidney care has never been greater. However, one critical challenge remains: ensuring high-quality dialysis care for individuals transitioning from home to a skilled nursing facility. With approximately 70,000 skilled nursing facility residents in the U.S. living with end-stage renal disease, these transitions often come with logistical complexities, care coordination barriers, and the need for seamless clinical oversight. Addressing these challenges requires innovative solutions that enhance care delivery in this environment. At AAKP, we are very proud of the fact that our membership includes a robust number of kidney patients living in skilled nursing facilities receiving dialysis, as well as their families. AAKP has increased our advocacy efforts on their behalf due to a series of issues related to Medicare payment policies and the impact of those policies on patient access to new drugs for infection prevention and optimal kidney health. Our focus on infection prevention for patients receiving dialysis in dialysis facilities and skilled nursing facilities is a part of AAKP's Every Patient Safety Awareness and Public Education campaign we launched last year. We encourage you to learn a bit more about this at bit.ly/everypatientsafe. Today, AAKP has partnered with Concerto Renal Services to explore best practices and strategies for improving dialysis care and patient outcomes in skilled nursing facilities and making the transition from home to a skilled nursing facility a bit easier. To kick off today's program, I would like to introduce AAKP's Vice President and Chair of Policy and Global Affairs, Paul Conway. Paul is a passionate advocate for patient-centered care, patient participation in true shared decision-making, and the use of patient insights in kidney research. As a kidney disease patient himself for 47 years and a 28-year transplant recipient, he has been recognized for his advocacy work with several national awards, including the President's Medal from the American Society of Nephrology. Paul has served in 4 U.S. presidential administrations, including as Chief of Staff for the U.S. Department of Labor. He was selected by the FDA to serve as the inaugural chair of the FDA's Patient Engagement Advisory Committee and has served on the American Board of Internal Medicine Nephrology Specialty Board, as well as multiple CMS technical panels related to dialysis quality improvement measures. Before we begin our discussion, we want to highlight the real experiences of kidney patients and care partners navigating the transition to skilled nursing facilities. To gather these insights, we launched an independent flash survey through AAKP's Center for Patient Research and Education, which is still open. We strongly encourage you to share your expectations, experiences, and perspectives on kidney care and skilled nursing to help us better understand the challenges and potential policy issues in this space. Paul is here to walk us through some of the preliminary survey results. Paul, I turn things over to you.
Thank you very much, Jerome, and thanks for your many years of service to AAKP and educating patients and being a close ally to everything that we do and trying to elevate patients in decision making. Your work is absolutely fantastic, and we appreciate it. So, folks, what I'd like to do is go ahead and walk through some of these preliminary results of our survey. The survey remains open, and we would encourage you to participate in it. But these are the insights that are coming from patients and family members. And this is what we call true patient-centered care, taking your insights and sharing them with policymakers and with providers so they have a better sense of what's important to the patients as they're making these critical transitions. Here we asked if participants or a loved one had transitioned from home or in-center dialysis care to care in a skilled nursing facility. At the present time, 17% of the participants in the survey have said yes, 83% have said no, they're not at that point. So we're really focused on the families and the individuals who are making those decisions to have to transition. So we asked, what's the primary reason? And across the board, primary reason has been the need for additional medical support given the stage of life or the position in life that they're currently in. We asked what type of dialysis care patients would prefer in a skilled nursing facility setting. On-site dialysis within the actual skilled nursing facility, 60% of participants thus far have said that was their preference. Access to a nearby in-center dialysis facility, 40% indicated a strong interest. On this question, we asked if you had to transition to a skilled nursing facility for dialysis care, what factors would define high-quality care from your perspective? And again, this is a good reflection of patient-centered care and patient insights into what they define as high quality. Right off the bat, very strongly, safety and high standards for infection prevention, including catheter-related bloodstream infections, or what we call CRBSIs. Is first, maintaining independence and quality of life. You can see that's equally high. Staffing levels that meet regulatory requirements, clear and consistent care coordination among healthcare professionals, emotional and social support. That's why we're so very pleased, rates quite highly, and we're very pleased that Concerto has one of their key social workers with us today to have this conversation. And then transparency in all insurance coverage and cost issues. What's interesting to us in looking at this slide is you can see how high infection issues are, maintaining independence, and then things that get into regulatory issues, but are really, again, safety issues for patients, which are staffing and clear coordination among providers. We ask, what concerns would you have about transitioning to a skilled nursing facility for dialysis care? And again, the issue on safety and catheter-related bloodstreams infections is very high. Finding a skilled nursing facility that provides dialysis care, this is one of the practical issues that people will scope out if they're currently on dialysis or it's anticipated that with kidney failure they will be on dialysis. Quality and expertise of dialysis staff rates highly, and adjusting to a new living environment, and then the sense of loss of independence. But again, we take a look at the cluster of issues at the top here, very interesting to us in the decision-making of patients and families. And then this was interesting also. We asked, how important is it to you that a skilled nursing facility staff has knowledge about dialysis care and involve you, the patient, in decisions related to infection prevention and your safety? 100%. This is important when we're having these conversations. I want to share a few insights from a survey that we recently did, also related to the concerns of dialysis patients. And it will show you some of the factors that go into these larger decisions related to transitions for patients and families. So we asked if patients or a loved one who as a patient ever experienced any of the following healthcare associated infections. These are infections that happen in health facilities. And select all. 30% of the patients that we had and family members that we had participate in our survey had indicated that they had had a catheter-related bloodstream infection. Sepsis was also a very high rating. Staph infections and other infections, you can see kind of waterfall down from that. But among the dialysis population, it is well known that infections are prevalent. And so, therefore, then what do? You can see here asking patients their confidence levels. If a dialysis station has been adequately disinfected to follow good practices, very confident. The majority are somewhat confident. So you put those together, about 92% have a degree of confidence in it, with lower levels of less confidence. This one was interesting to us. This shows the patient or the caregiver being proactive in their care. We asked, do you actively remind your or your loved one's dialysis team about hand hygiene during dialysis sessions? These are some of the fundamentals of care. Yes, always remind them. About a third of patients and caregivers are reminding the technicians that take care of them to maintain good hand hygiene. Sometimes others have a great deal of confidence, or they're less proactive in asking for that. We asked patients and caregivers how dialysis centers and providers could improve their infection practices. And this is interesting to us because over half said the issue of choice and access to innovations that protect them during their treatments are very important. More consistent hand hygiene, clear communications about infection risk and prevention. So you can see that some of the basics, having access to the tools that help prevent infections, and then the basics of infection containment and prevention are critical. More frequent cleaning, improve access to protocols, waterfall down. But again, right off the top, the number one thing that patients are interested in is having a choice and a voice and access to innovations that help them and empower them to prevent infections. Then we asked patients and caregivers if a new medical innovation were available to you or to a loved one to help better protect their dialysis catheter access. This is for hemodialysis patients, and help reduce the risk of life-threatening CRBSIs. Would you want them or their dialysis center to provide that choice? And the answer was 83% yes. Some people were unsure about it. Probably the most important thing for everybody to understand is how you define dialysis care from a patient perspective or a loved one perspective is critically important. And it's critically important that you have the confidence to communicate those things. At AAKP, we define quality healthcare and quality dialysis as those treatments that best align to the aspirations of the patients, and that you provide that treatment in the most safe manner possible, and that you engage the patient to the greatest extent possible so they can be involved in the decision making and they can make clear choices. Transitioning to a skilled nursing facility is a difficult decision. It's a decision that involves family. It's a decision that involves caregivers. It's a decision that involves medical professionals and the providers. But what's very true throughout all of this is that respecting the concerns of patients and understanding that they have expert knowledge based on their experience in their care, that should be respected. That's why we're very pleased to have Concerto participate with us and to be able to walk through their protocols and inform you as patients and as families on some of the practical things that you need to know. They are one of the largest providers of dialysis services in skilled nursing facilities, and it gives us great pleasure to hear directly from providers so that you are better equipped with the information. And as we say at AAKP, you want to know all of your options as far as in advance as possible. So we're very pleased to have them with us today, and we encourage folks to keep participating in this survey because these insights are important not just to providers, but also to government policymakers so they know exactly where you stand on some of these critical issues. I'll throw it back over to Jerome. Thanks again, Jerome.
Thank you, Paul. Appreciate that. And as Paul mentioned, for those of you who would like to share your perspectives about skilled nursing facilities and participate in the AAKP Flash Survey, please visit surveymonkey.com/R/ZJDCX56. Now to our speakers. Emmanuel Harris is the Director of Quality at Concerto Renal Services. With over 10 years of experience as a registered nurse, a passion for healthcare, and a commitment to excellence, he is applying his expertise to ensure the highest standards of patient care. Emmanuel obtained his bachelor's in nursing in 2018 and is currently pursuing his master's of science in nursing with a focus on health informatics. He believes this will further enhance his expertise in healthcare technology and data management, which he believes will improve patient outcomes. Emmanuel, I turn the program over to you.
Good morning, Jerome, and thank you for that introduction. Today, we'll be discussing key considerations for supporting care partners when a loved one transitions from home to a skilled nursing facility, particularly focusing on dialysis care in these settings. We recognize that this transition can be emotionally challenging for both patients and their loved ones, and our goal is to provide practical guidance to help care partners navigate this journey. So our agenda today will focus on one, introducing Concerto Renal Services. Next, we will discuss clinical care management considerations. We'll follow it up with emotional support and resource advice. And lastly, we'll discuss nutritional care and dietary management. Kidney failure has become a growing crisis in the United States, especially among our senior population. In 2018, nearly 786,000 Americans were living with end-stage renal disease, and 80% of those patients were 65 or older. This represents a significant portion of our nursing home residents. Traditional outpatient dialysis centers create several challenges for nursing home residents. First, the transportation to and from dialysis centers is disruptive to their daily routines and often physically exhausting. Next, the frequent movement between facilities significantly increase infection risk for these vulnerable patients. Next, many nursing homes face placement difficulties for complex patients requiring dialysis. And finally, the traditional dialysis model has historically focused on younger, more active patients rather than adapting to the unique needs of the geriatric population. These challenges don't just affect patients. They create significant stress and anxiety for care partners who want to ensure their loved ones receive optimal care. Many care partners tell us they're worried about transportation risks, treatment consistencies, and whether their loved one's specific needs will be properly addressed. Our solution at Concerto Renal Services directly addresses these challenges. Founded in 2015, we provide on-site 3-day hemodialysis in a comfortable home-like setting within skilled nursing facilities. Our approach treats patients with all comorbidities, including those with ventilators, tracheostomies, and other complex conditions that often make traditional outpatient dialysis impossible. Importantly, we maintain a familiar treatment schedule that patients are accustomed to, which minimizes disruption while maximizing care quality. For caregivers, our model offers peace of mind knowing that their loved one is receiving consistent, high-quality dialysis care without the stress of transportation and the continuous oversight from the nursing facility staff they've come to know and trust. Let's discuss why many patients require dialysis in a skilled nursing facility setting. These are some of the scenarios we may encounter. Patients recovering from acute illnesses often need continuous monitoring alongside their dialysis treatment. This includes complex cases like patients who may have experienced heart failure and require specialized care that integrates their cardiology and nephrology needs. These patients benefit tremendously from an integrated approach that only on-site dialysis can provide. For care partners, this integration means fewer specialists to coordinate with and a more cohesive treatment plan. Second, many patients need short-term rehabilitation following hospitalization while also managing their end-stage renal disease. This combination of rehabilitation therapy and dialysis treatment requires careful coordination to ensure optimal recovery. When dialysis is provided on-site, patients can focus their energy on rehabilitation rather than spending it on transportation and waiting times at external dialysis centers. Care partners can participate more easily in rehabilitation sessions and care planning when everything happens under one roof. Third, patients with multiple comorbidities often find traditional outpatient dialysis challenging or unsafe. This includes those with mobility issues who struggle with transportation, cognitive impairments that make the outpatient process confusing or distressing, or specialized equipment needs that are difficult to accommodate in traditional settings. For caregivers of these patients, our on site model eliminates the logistical challenges they would otherwise face in coordinating complex care needs across multiple settings. Finally, we serve what we call post acute patients, those who are too ill for outpatient dialysis but stable enough not to require hospitalization. These patients fall into a critical care gap that our SNF based dialysis program perfectly addresses. They need more medical supervision than an outpatient center can provide, but don't require the intensive resources of a hospital setting. For care partners, this option provides an appropriate level of care without the stress of frequent hospitalizations. Now, I'd like to discuss our comprehensive approach to clinical care management. Let me start with our approach to patient care. This begins with a thorough assessment of each patient's medical condition and specific dialysis needs. We don't just look at kidney function, we evaluate the whole patient to develop an appropriate care strategy. We collaborate extensively with specialists, including the patient's nephrologist and primary care provider. This multidisciplinary approach ensures continuity of care and leverages the expertise of all healthcare professionals involved. Based on this information, we develop individualized care plans that address all aspects of health. These plans incorporate dialysis parameters, medication schedules, nutritional considerations, and rehabilitation goals. We encourage care partners to join these collaborative discussions when appropriate. Throughout the treatment process, we maintain ongoing communication with the entire healthcare team to ensure everyone is aligned on the patient's status and treatment goals. Medication management is another critical element of our care approach. We ensure timely administration of dialysis-related medications, which is essential for treatment effectiveness. We also perform monthly medication reconciliations to ensure that we are aware of all medications a patient may be taking. We provide specialized care for phosphate levels and other ESRD-specific issues such as anemia, which requires careful monitoring and management. Our staff has extensive experience with these specialized aspects of dialysis care. We also educate care partners about these issues so that they can better understand the treatment goal and dietary considerations. We continuously monitor medication effectiveness through regular assessments and lab work, making real-time adjustments to treatment plans as needed. This responsive approach ensures that our patients are receiving high-quality care. Finally, managing complications proactively is essential for successful dialysis outcomes. We maintain coordination with nephrology and any specialized interventions that may be needed. We focus on infection prevention at vascular access sites through rigorous protocols and staff training. We also regularly assess vascular access functions to identify any potential issues. When complications do arise, we provide early interventions, such as a dialysis access evaluation referral, which often prevents minor issues from becoming serious problems that could require hospitalizations. So, to reiterate, our on-site dialysis model at Concerto Renal Services represents a significant investment in care for skilled nursing facility residents with end-stage renal disease. By eliminating transportation burdens, reducing infection risks, and providing integrated comprehensive care, we're improving both clinical outcomes and quality of life for these vulnerable patients. For care partners, our approach offers the peace of mind and simplifies coordination of complex medical needs. Thank you for your time and attention today. I hope this brief overview of Concerto Renal Services helps you understand why SNF dialysis is so essential for our vulnerable populations.
Thank you, Emmanuel, for that enlightening presentation. We appreciate you being with us today. Our next speaker is Jeff Burkhart. Jeff is a seasoned renal professional with over 3 decades of experience serving the ESRD population. A graduate of The Ohio State University, Jeff began his career as a patient care technician with Fresenius Kidney Care. He transitioned into the role of facility social worker at American Renal Associates before advancing to lead social worker. Jeff held this leadership role at American Renal Associates until 2021 and currently serves as lead social worker for Ohio and Michigan at Concerto Renal Services, a position he has held since 2023. Jeff, welcome to the program. I'll turn things over to you.
Hello, Jerome. Thank you so much. And thank you, Paul, and the AAKP for allowing me to be part of today's presentation. As Jerome said, I've been a healthcare professional my whole adult life, and working with the ESRD population has been a bit of a professional calling for me. So it's really an honor to be able to talk to you guys today about the role of the renal or dialysis social worker. One of the main roles of a dialysis social worker is to really monitor and evaluate dialysis patients for psychosocial issues that may come about, particularly with dialysis patients who transition over to skilled nursing or long-term care facilities. There is a real loss of independence. They may struggle with feelings of loss and grief about not just maybe beginning dialysis therapy, but transitioning into a new living environment. So they feel a loss of autonomy, the increased reliance on medical professionals and others for their activities of daily living. This causes them to feel a loss of control. The prevalence of depression and anxiety is higher in general with patients living with end-stage renal disease compared to the general population. So add to this, a major life change like admitting to a nursing facility. So support from social workers can play a vital role in easing these effects. And we as dialysis social workers are required by Medicare to monitor for depressive symptoms routinely through the patient's experience with us. And we can access resources like behavioral health counseling or pharmacological interventions through a medical provider if that's something that a dialysis patient would benefit from. And of course, you're looking at the adjustment issues that come from admitting into a facility like a skilled nursing or a long-term care. They operate on very specific schedules. It's louder. It's just no place like home. They may need support adapting to this, being able to express frustration, being able to adjust routines. They may be dealing with roommates and staff members who are unfamiliar with their needs. So we help process that with them and can be an advocate for them with the SNF if they come to us with concerns. We're also required to monitor health-related quality of life in patients living with kidney failure. Add to that a change in environment coming to a nursing facility. They're going to struggle with a reduction in their perception of their health-related quality of life and exhibit other health-related social needs. So a dialysis social worker, we're trained to evaluate and utilize tools to monitor these types of issues and address any issues that come up in collaboration with skilled nursing facilities, social services. Here are some of the family supports that can be available to care partners who are assisting patients with transition into skilled nursing facilities. So dialysis social workers can provide the patient and family with step-by-step care and education in the process of transitioning dialysis care within the SNF setting. And transition support can also mean spiritual and culturally competent services to help address any specific needs that align with a patient's beliefs or values. Social workers are often a conduit when it comes to coordinating care between a family member or a care partner and the patient's dialysis interdisciplinary team and the SNF administration and staffs. So we're developed to encourage families to be involved in care plan meetings with the dialysis team and the nephrologist, and as well as the care conferences that the SNFs schedule. And this way you can ask questions. You'll have a running knowledge of the care plan, which are what some of the goals we may have as far as their dialysis care and their SNF, physical and occupational therapy. And it also helps build rapport and a mutual sort of understanding of the patient's needs within their care team. We do a lot of communicating and collaborating between the patient, the families, the SNF staff, and the dialysis team. So we're always going to be that clear channel of communication between care partners and the various interdisciplinary teams. So utilize us. And then we do provide a lot of education on the dialysis process, how dialysis may impact a patient's overall condition. And we will help answer questions about treatment schedules. We may talk about different modality options like transplant, peritoneal dialysis, and then, of course, any quality of life considerations. Here's a list of recommended support resources for both patients and care partners. So the National Kidney Foundation is an amazing resource. They offer tons of educational materials, peer support programs, and helplines. This is an organization not only that supports patients living on dialysis, but also people at risk for kidney disease and for end-stage renal disease and their families. And of course, the American Association of Kidney Patients, they're an amazing resource. They provide a lot of advocacy, and I personally have used their support group locators, and they have great virtual options now too if there aren't support groups in your area. The American Kidney Fund provides educational material and financial support programs for patients living on dialysis. So they have limited financial resources related to help with insurance premiums and transportation related costs. Of course, dialysis and SNF social workers, we provide ongoing support to patients and families. Even after transitioning to a nursing home, we can help connect families who are even concerned about where their loved ones are going to get resources post transition from skilled nursing. Most of us have a lot of knowledge in the case management arena where we may know resources that we typically don't engage while they're in nursing facilities. Of course, we may have some idea of local support groups, both for the patients and for care partners, and hybrids for both sets of individuals. And palliative care and hospice resources. So if end-of-life questions are being posed, or you want to have some measure of knowledge about those kinds of things, we can help assist with that. Every skilled nursing facility is contracted with hospice and palliative care services. And then we're all trained as social workers to help navigate advanced directives and do not resuscitate forms and those types of questions. And here's a handful of items that I thought would help care partners know how to advocate for your loved one or people that are under your care. Staying informed is paramount. Understanding your loved one's dialysis needs and participating in their care plans and care conferences. Not being afraid to ask questions. Come prepared. As you have questions, write them down on a pad and bring that information with you. I can tell you from personal experience, nothing satisfies me more than to be able to answer questions for family members who may be struggling with decisions that they have to make. Visit regularly and observe. The more that you're in that environment, the more staff will recognize you, and you're able to monitor care, build relationships with those staff members, and then notice any changes in your loved one's condition or the type of care they may be receiving. Respectful communication, establish a point of contact among the SNF and the dialysis staff. It's perfectly acceptable with the patient's permission for the dialysis social worker to be that point of contact. And then always know that we're here answer questions and to provide any sort of advice or advocacy on yours or the patient's behalf. And then voice concerns for the dialysis staff as quickly as you can. Both organizations will have processes in place to address concerns. For Concerto's, on our behalf, it's the grievance process, which we encourage patients and family members to, if you have a concern or a complaint about your care, to have it addressed internally within our organization. We have an actual process for that. And then the nursing homes and long-term care facilities will also have their version of that if you have a concern or a complaint about your care. And then also know residents' rights. That's another required process of education for any dialysis patients, that they understand their rights and responsibilities as a dialysis patient in a dialysis facility and also as a resident of a skilled nursing facility or a long-term care facility. So carefully read and understand your loved one's rights and responsibilities. And most agencies and organizations will also have a set of facility rules, so that you, again, aren't surprised by anything if there's a responsibility or rule that was violated by a loved one. That's it. Thank you so much. I appreciate it.
All right, Jeff, thank you for the great work that you do for dialysis patients and their families, and for providing us with more insights into the social services available when transitioning to a skilled nursing facility. Our next speaker is Jackie Glue. Jackie is the manager of clinical nutrition at Concerto Renal Services. With over 20 years experience as a registered dietitian, Jackie has demonstrated a deep commitment to renal nutrition, exceptional leadership, and innovative approaches that have significantly contributed to the nutrition department's success at Concerto. Thank you for being with us, Jackie. I'll turn the program over to you.
Great. Thanks, Jerome. So what I'm going to do today is I'm going to talk about how the renal dietitian will help patients at the nursing home. So we are going to talk about what we do within nursing home dialysis. So renal dietitians working in nursing homes, how is it different from outpatient dialysis? So many of our dietitians do come from outpatient dialysis, and so we are familiar with that process, but we are now working within the nursing homes. So we are now tailoring it to you, the patients, within the nursing homes. So it becomes a little bit easier for us. We now have another set of team members within the nursing home. So meals, supplements, binders, other medications are now provided by the nursing home, and that has now become the patient's home. So communication, collaboration between the dialysis team and the nursing home interdisciplinary teams becomes very important. We need to contact each other. We need to collaborate with each other to make sure that we're all communicating along the same lines, to make sure that our plan for you, the patient, is consistent. So renal dietitians collaborate with the nursing home dietitians continually and in person whenever possible. But also renal dietitians collaborate with other team members within the nursing home, from the kitchen, from nursing, from speech therapists who might help you with any swallowing issues, any chewing issues, maybe wound care team members because you might have wounds from recent surgeries, or maybe from infections. Maybe your physical therapist or occupational therapist team members might have some input. So we're talking to many other team members who would help to round out your care plan. So we still do educate our patients in much the same way. We want to make sure that you are up to date on what your care plan is, and we educate you wherever we can find you. And in outpatient, we can find you in your chair, but now that we are in your home, we can find you in many other locations. We can chat with you, again, chairside during dialysis. We can find you in your rooms when you're not on dialysis. We can find you maybe at your dining room table. We can find you during activity sessions. Maybe your family or caregivers want to talk to us, so we can talk with them on the phone. or we can chat with them by email. And if we do that, we can also send them copies of your lab work. And this is a snapshot of what your lab work might look like. And this is a monthly nutrition report, or sometimes you might call it a report card. And you'll get this in dialysis outpatient, but you'll also get this here too. And it goes through labs that you're probably familiar with, like albumin, potassium, calcium, phosphorus, PTH, KT over V, or sometimes it's called URR, which tells you how clean your blood is getting during dialysis. And we put it in very clear wording so you and your family can understand what's going on, and if something is out of range, how can it be corrected? And then we also work on educating nursing home staff, because they may not be as familiar with the renal diet as the rest of us are. So we work in tandem with the nursing home dietitians to provide education. We educate the nursing home staff not to give patients water pitchers at the bedside. We educate them not to give huge cups of ice, because maybe you're on a fluid restriction. We also and instruct them to check the diet orders, maybe before they give you snacks. So maybe you're on a diabetic diet, maybe you're on a renal diet, maybe you're not. But we want them to make sure that they are checking before they give you snacks randomly. And also make sure that they're not giving patients any food without binders if you're prescribed one. So renal diet, what are the options? So the diet options will depend on your labs and your medical needs. So you may not necessarily be on a renal diet automatically. We want to make food enjoyable for you. So your diet can range from renal to maybe simply no added salt, which means no salt packets on your tray, to low potassium, which would be no orange juice or no tomato sauce or no banana on your tray, to a general diet. We tailor it to you and your labs. And we also want to make sure that we take your chewing needs or your swallowing needs into consideration. So we might liberalize a therapeutic diet, such as a renal diet, when the person's in our care. So if you're not eating well, we want to make sure that you are. So if you have a poor intake or you're struggling to meet your nutritional needs, we want to open up your diet options. Maybe you are starting to lose weight, or you're at high risk for malnutrition. Like I said, maybe you have a large wound and we need to get that to heal. Maybe you need improved quality of life. Maybe you're just not thriving in the nursing home and you're tired of the options. So we need to open up your options and give you more choices at your meals. So we will work with you to see what diet options are best for you. It's not a one size fit all for everybody. So other options that we can consider, you're going to be asked about your food preferences. So most nursing homes have a standing substitute menu. So if you don't like what's on the menu that night, you might have, say, a ham sandwich or a turkey sandwich. Maybe there's a chef salad, etc. So there's something that the kitchen can make for you if there's something that you don't like. Most nursing homes do have vending machines, and we can talk about better options at the vending machines. So if there's something you just need a snack, there might be something that you can go get. Families can always bring in meals. So I'm often talking with families about what are better options that they can cook, because we do miss home cooking when we're away from home. But if you don't have family or friends that can bring in meals, there's always DoorDash, there's Grubhub. We work with people to order better options from local restaurants. I have many patients who do their own snack ordering from Amazon and have that delivered to them. Some rooms have small fridges, and so some will even order small grocery orders from local grocery store to keep some fresh things in their rooms too. So there are many things that we can do to make sure your home is your home. So we just want to thank AAKP so much for inviting us, and I'm going to turn it back over to Jerome.
Thank you, Jackie, for sharing your expertise and experiences of working with patients transitioning to a skilled nursing facility. As people registered for today's webinar, they were able to submit questions for the speakers. I'd now like to ask our speakers some of the questions that were submitted by our audience members. Jeff, what are some tips you would give someone to advocate for a loved one to receive the same level of care and attention they had at home?
Yes, thanks. That's a great question. I think the most important thing is to be present and ask questions, participate in the care conferences and the care plan meetings with the dialysis interdisciplinary staff. That way you're building relationships with the people that are charged with your loved one's care. And then there are things that that you can do on a tangible level, which is share their usual home routines with the staff at the SNF to help ease the transition, bring things that they're comfortable with and have from home to make the space more comfortable, like blankets and iPads and favorite pictures, those kinds of things that helps develop a sense of home and a sense of belonging with the staff as well.
We have another question also for Jeff. And the question is, what if I notice a change in my husband's care or health? Who should I reach out to first? The SNF staff, the dialysis provider, or his kidney doctor?
Well, I think it depends a little on what the change, what care we're talking about. So if you've noticed a change in the loved one's care from a dialysis perspective, so if it's related to their dialysis care, discuss that with the dialysis provider. And again, I mentioned in my earlier presentation, we have a process in place to address concerns, and that will also involve regional management and the nephrologist or the kidney doctor as part of the escalation process to get any concerns addressed. So if it's related to dialysis care, talk to us. If it's related to SNF care issues, they have a very similar process that's independent of ours. That doesn't mean you can't come to us with concerns about the care. We're natural collaborators home on the patient's behalf if necessary. But I think that's the best route for that type of issue.
Jeff, we got one more question for you. What should families
No pressure.
look for? What should families look for when choosing a skilled nursing facility? Are there any public and transparent rating systems in place for these types of facilities?
Yeah, in my experience, I think the most comprehensive resource is Medicare, Medicare.gov. So their website has a provider search engine and process where you can engage that for a number of healthcare services that Medicare has a stake in. So nursing home facilities, hospitals, home health care providers, outpatient dialysis clinics, you can search on Medicare.gov for the closest facilities based on your zip code or address. And in that, Medicare has implemented quality rating systems that measure specific outcomes depending on the service that you're looking to research. So if you go under their, I think it's their Services and Providers tab on Medicare.gov and search under nursing home facilities, you'll have really, really comprehensive information about how that any particular nursing facility in the area you're looking does with their outcomes and other quality measures that Medicare monitors. But I will say, and lastly, nothing beats an on-site visit and tour to get a feel for these facilities. So I would suggest doing both in tandem so that you can get a feel for the cleanliness and the approachability and engagement of the staff, and the access to activities and outdoor spaces and those kinds of things that I think really help patients transitioning into this type of care would really want to see in a facility.
So our next question is for Emmanuel. Are there specific questions I should ask the skilled nursing facility team about dialysis oversight and care coordination?
Yeah, sure. There are a lot of questions that loved ones may want to ask about their families receiving dialysis in the SNF, but I think some of the important questions may be what protocols are in place for managing dialysis-related emergencies. You want to ensure that the SNF has a process or some type of protocol with the dialysis facility to respond to any unfortunate emergency, any code blues or rapid responses. And you want to ensure that you as the caregiver is notified in a timely manner when these condition changes occur. Another question may be, how is dialysis scheduled to accommodate their other activities and therapies? One of the benefits of having all your care under one roof is that the patient is able to have their treatments without much disruption. So you want to ensure that mistreatments are minimized and that patients are able to complete all of their prescribed therapies. And I think that one of the maybe one of the most important questions is what measures are in place to prevent dialysis-related infections and complications. You want to make sure that the SNF is collaborating with the dialysis providers about infection prevention and understanding those signs and symptoms to prevent complications from getting worse.
So we have one last question, and it's for Jeff, actually. So, Jeff, what advice do you have for care partners who may feel overwhelmed or uncertain about making the transition?
I would say it's not unusual. It's a typical. I would think it's unusual to not feel overwhelmed or not to have feelings of guilt or worry about such a major decision. So I think it's important that that you make an informed decision. So research and visit facilities in advance of the transition if you can, so that you can make a good informed decision about the space that your loved one's going into. And if you can, include the individual in the decision-making process. So empowering that person that you're caring for to be able to help make that decision. It gives just a little bit of control back to them, so they don't feel that their environment is being pulled out from under them. And it may help the process go a little more smoothly.
Thank you very much. That's all the time we have questions for now. I want to extend a heartfelt thank you to all of our speakers, including AAKP Vice President Paul Conway, the team from Concerto Renal Services, Emmanuel Harris, Andrew Roberts, and Jackie Glue. If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. In closing, if you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, join online at aakp.org 1-800-749-2257/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As a member of AAKP, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive digital subscriptions to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download free of charge, including titles such as Pocket Guide to Managing Infection Risk for Dialysis Patients with Central Venous Catheter Access, or the conversation starters about questions to ask your healthcare team about choosing the right therapy for you, or questions to ask your healthcare team about changing dialysis therapies. You can also order materials by phone. We are excited to announce the dates of our 2025 events. The 7th Annual Global Summit on Kidney Disease Innovation, hosted in partnership with George Washington University School of Medicine and the Health Sciences, will take place virtually May 22nd and 23rd. Registration is free and is now open. The 8th Annual AAKP Public Policy Summit will be held on June 27th at the National Press Club in Washington, D.C. Registration for this free event will open soon, and a virtual option will be made available for those unable to join in person. And the 50th Annual AAKP National Patient Meeting will also be a hybrid event, taking place October 3rd through the 5th. This is our golden year for the patient meeting, so it's a not to be missed. Additional details on location and registration will be announced soon. Please continue to visit our website and follow us on our social media channels to keep up to date on the latest events and information. Finally, you can visit our special AAKP On Demand webpage at bit.ly/AAKP On Demand to watch a number of great presentations and webinars, all available on demand from our 2024 events and programs, as well as 2025 programs as they occur. You can also visit the AAKP YouTube channel at AAKP YouTube for more great content. We would like to once again thank our webinar speakers for graciously participating in today's HealthLine event. Their expertise, insights greatly enriched the discussion and provided valuable information. And thank you to everyone who joined us. Before we close, we'd like to remind you that the AAKP Flash Survey on Skilled Nursing Facility Care Coordination is still open. If you haven't had a chance to participate yet, we encourage you to share your insights. Your feedback helps shape important conversations and future efforts. Have a great rest of your day.